So yeah, I was curious, how are people using cannabis kind of to treat their symptoms? Is it sort of like a preventative thing or like a kind of daily usage just to kind of keep symptoms at bay, or do they actually use it in an acute situation where, like you said, having a panic attack or having an episode, ingesting cannabis to kind of get back to baseline?
That's a really great question. So, first of all, for the research study, we just started collecting patients in October. So we're still in the data
Sure.
collection. Or well, I mean, we don't even have any data yet. We're still in the patient recruitment part of that study. And then once we get all the patients and we sort of close off, which I think we're doing January 1st, then we're going to do, we have that like 6 months is the survey. So there's that. But in my practice, so I am independent. I work as a consultant. I'm a registered nurse and I coach people and work with people alongside of their doctor um, as a bridge. My favorite thing to say about nursing and cannabis is, well, holistic and plant medicine overall is we are the bridge. We're the bridge between the provider and the dispensary for the
Mm.
patient. We're the bridge between like traditional medicine and then holistic and integrative medicine. I'm writing a book. Nurses are the bridge, coming soon, hopefully by Puerto Rico. So,
Excellent.
as that nurse coach, nurse educator in my practice with patients, I have many people that have suffered from like sexual trauma, domestic violence, and uh, many of them are women, and many of them have like an overwhelming sense of doom
Mm.
every day.
Wow.
And there really aren't a good group of or a good protocol for prescription medications. I'm a plant medicine nurse, but I'm very much also for integrating traditional pharmaceuticals. We just don't have a lot of traditional pharmaceuticals that work, or that you have to take so many, or the side effects are so much that can relieve the symptoms. So I have people, getting back to your question, that take a low dose of just something routinely, which we have some pretty good data, and some of our friends that are very involved with um, CanMed and medicinal genomics would share that, 1-to-1 equal amounts of CBD and THC have been known in low doses to be helpful for anxiety. And so I do have some people that utilize those types of routes of administration. We're getting more data, more research recently about another cannabinoid, CBG, being really helpful also for anxiety. But to your point, depending on when their symptoms are worse generally, so if it's not that they just wake up every day with that impending doom and need something, if it is more about being in the world and being triggered, like potentially somebody that was in a traumatic car accident might have anxiety just every time they have to get in the car and drive. And I'm not going to encourage people to smoke a little bit before they get in the car and drive. We have to be thoughtful, right? So in that case, we definitely would be considering a less intoxicating route, uh, less cannabinoid and less intoxicating route. We want people to be safe on the road. But if it is that they're going to be home, or they're in an environment where they're not the driver, then potentially, if they are triggered, having an inhalation
Mm.
option available, whether that is inhaling, like a lot of times, honestly, I tell people with post-traumatic stress disorder and like panic attacks related to it to consider carrying a vape pen like it's an EpiPen.
Mm.
So have it on you. You don't have to, again, in a legal state where you legally can use it, have it there. Just knowing you have it might help you. You might not even need to use it, but it's easier and more accessible than having to actually light something and smoke it in environments where with the state of our country, we still not be able to do that everywhere. But I have had experience with multiple patients where just having it in their purse, on their person, just knowing they have it has been enough for their brain to release the sympathetic nervous system, get back to a more natural response, and feel better, and or they can take a puff or two and immediately have some relief. So I think it can be used, and I'm interested to see the survey responses, because I think it can be used for like the in the moment,
Hmm.
but we would be looking. My goal for most people is hopefully to prevent having to even get to that, having to prevent those feelings, because when our body is releasing all that cortisol and going through that triggered response, it's unhealthy for us. It doesn't feel good. I mean, I've had panic attacks. It doesn't feel good. So I would prefer it if we could just keep the edge off that and utilize the tools of cannabis medicine, plant medicine, and maybe entheogenic medicine, some psychedelics to do the work, do the therapy, retrain our brain to learn a new response.